With roots in restorative, iTero intraoral scanners are designed to streamline and enhance a range of digital workflows, including chairside 3D printing. Dr. Andrew Reingold will demonstrate how the iTero scanner's open system helps him to work seamlessly with his Exocad planning software and 3D printer for the creation of a bite splint. Just one example of the many dental appliances iTero scanners can help create at Chairside. This patient visited Dr. Reingold with the chief complaint of headaches caused by grinding his teeth. At the initial consultation, Dr. Reingold performed a full clinical examination. In addition to documenting the case with X-rays and intra- and extraoral photographs, he captured intraoral scans. Scanning his patients at every visit helps him to quickly and comfortably capture digital data, which assists with diagnosis and improved patient engagement. The 3D model offers Dr. Reingold a full visualization of his patient's teeth that can be carefully evaluated from all sides. And the occlusogram's color-coded display highlights the intensity of occlusal contacts and areas of excessive occlusal load, which aid Dr. Reingold in his evaluation of the clinical condition. After the full examination, Dr. Reingold's diagnosis was temporomandibular joint disorder. Dr. Reingold concluded that a bite splint would be the best clinical approach. With all the necessary technical infrastructure conveniently located at Chairside, he proceeded to digitally create the splint. First, he exported the iTero scan to the Exocad software. With Exocad's bite splint module, it's possible to quickly design high-quality therapeutic bite splints in just a few steps. The add-on module's extensive functionalities allow Dr. Reingold to virtually adjust the occlusion and remove undesirable interferences. It also allows him the option to smooth and morph the surface of night guards individually, or to automatically flatten the posterior occlusal surface. After a few steps, the bite splint design was ready for fabrication. The designed CAD files were quickly imported into the pre-form print preparation software for print setup before being sent to the Formlabs 3D printer. After printing, Dr. Reingold finalized the work by washing, drying, and post-curing the splint. Post-processing involves less labor, time, and cost, thanks to the Formlabs printer automated solutions, Form Wash and Form Cure. Thanks to the iTero scanner's open system and chairside efficiencies, the bite splint was ready to be tried out. Dr. Reingold gave the bite splint to the patient to check for proper adaptation. In case any adjustments are needed, it is recommended to scan the bite splint outside of the mouth in order to keep an up-to-date file in the practice records. The patient was satisfied and very impressed with the fully digital, high-quality treatment experience. From here, Dr. Reingold was able to resume monitoring his patient at routine visits. This is just one example of how the iTero scanner's open system, coupled with Exocad and Formlabs software and tools, can help streamline your clinical workflows, simplify complex treatments, and much more. Which treatment will you tackle today?